Welcome back. The time now 8:46. October is almost over, but it's important. It is October is Liver Cancer Awareness Month. The American Cancer Society says liver cancer incidence rates have tripled in the last 40 years, with death rates more than doubling in that same time period. Wish TV medical expert Dr. Janelle Gordon joins us this morning for our morning checkup to talk about the causes, symptoms, and ways to prevent liver cancer. Good morning.
Good morning, Jeremy. How are you?
I'm good. So we were talking about this just before we went on air. You hear about some of the things tied with liver cancer, like cirrhosis, but you don't quite often look at the two and say, there's some connections here. So let's talk about this.
Exactly. So there are various types of liver cancer. The most common one is called hepatocellular carcinoma, or cancer. And the underlying cause for that is going to be cirrhosis or scarring of the liver. The underlying cause of cirrhosis can be varied, and that can include hepatitis B or C, chronic infections, alcohol, as oftentimes people are aware of, and also a disease which we formerly called non-alcoholic fatty liver disease, and people still commonly know as fatty liver disease.
So are these things common causes of liver cancer, or do they occur afterwards as symptoms?
Very common, and also can be preventable.
Wow. Okay, let's talk about some of the symptoms of liver cancer. How do you know when you're getting to that point where you need to get checked out?
Unfortunately, Jeremy, oftentimes patients will be what we call asymptomatic or not have any symptoms. So sometimes these findings can be picked up if they go into the ER for a visit and we see findings on imaging on their liver, or they get blood work done and it comes up positive for certain infections and we dig a little deeper. Other symptoms that patients can present with could be what we call jaundice, or yellowing of the skin or the whites of the eyes. Patients may have abdominal discomfort. They could also have what we call distension, or protruding out of their abdomen or belly. They may have bleeding from the gut, and they can also have nausea and vomiting.
So let's talk about the age group or types of people in general who are commonly affected. Is it similar to some of the other types of cancers that we see, that there is one age group or one ethnicity that sees rates higher than the other?
Sure. So when it comes to ages, it can vary. We used to think, especially for hepatitis B and C infections, that those were going to be bigger in our such as baby boomer populations, but what we're seeing now is even individuals younger than that. So hepatitis B and C are going to be contracted via body fluids, and that could be during sexual activity. It could also be used or transmitted during IV drug use. Other common populations that we see affected are going to be here in the U.S. are Asian Pacific Islanders, as well as our American Indians or Native Alaskans. We've also seen rising rates, unfortunately, in our Latinx population. But actually, rates are going to be highest globally outside the U.S. and sub-Saharan Africa, as well as Southeast Asia.
My goodness. So everybody needs to be on the lookout here.
Everybody needs to be on the lookout.
So what do you do? How do you prevent this? What are things you can do, lifestyle changes we can make?
So I keep on driving home the point of making sure that you have a primary provider. If you're unsure where to turn to, again, contact your local health department. All adults need to be screened for hepatitis B annually, and for vaccinations, we start that as early as the first visit with the baby in the hospital after they're born. So infants, children, and adults need to be vaccinated against hepatitis B. I want all U.S. adults to also be screened for hepatitis C, and if you're positive and you have findings that warrant treatment, please get the treatment and please follow up. In terms of diet or nutrition that you can focus on, remember we talked about fatty liver disease, which is formerly known as, is an underlying cause for cirrhosis, and that is an underlying cause for liver cancer. I want individuals to decrease their saturated fat intake. So focus on whole foods, not those ultra-processed snacks that we often run to for convenience. You want your fruits and vegetables, which are going to be full of antioxidants, which can help fight off any inflammation that might be occurring in your liver. And decrease that alcohol intake. Now, I'm not saying you can't have any, but I do want you to limit, and some individuals should consider even abstaining.
Now, one thing we want to cover before we go to Tara here, let's talk about the actual amounts that you say adults should stick with per week, because that's one thing we talk about in all segments.
The alcohol.
Yes.
Correct. So studies are coming out more and more telling us that we really can't safely recommend a certain amount for individuals. So for adults, legally, 21 and up, we've previously said that you could have 1 to 2 drinks a day. Usually 1 for the woman, 2 for the male, depending on body composition. But we're finding more and more that increased alcohol intake is tied to cancers, not just liver cancer, but we've talked about breast cancer this month. October is Breast Cancer Awareness Month. It increases your risk for Alzheimer's disease, all sorts of conditions. So it's really hard to say, oh yeah, go ahead and have that beer. But I'm not here to make anyone feel like they have to be restricted in their lifestyle. I just want to make sure our viewers and patients are informed.
Wonderful. Thank you so much for the guidance and all the helpful information. You can find more on wishtv.com. And now we turn things over to Tara.